Alright, so here is the setup.
This is the cement that we're going to mix. We're eventually going to mix those. We have our pad here. We have our spatula. You have the etch, the buckle, and the lingual of the teeth that the bands are going to go on. And we have our lovely patient here who's going to be our demonstration.
There.
So the first thing you do, it comes in one piece, and I should have shown it outside of the mouth, but you detach these two first so you can separate the lower from the upper, and then you try in the lower, and then you try in the upper. So eventually what's going to happen is we're going to put these into this little guy here and tighten the screws up, and we're good. So this is just a pre-tie-in, and as you notice down here on the bottom, open up a little bit for me, we had to take off the brackets on the 4 and the 5 here because our arm would be in the way of it. So before the appointment, we took those brackets off, took the impression with the bands, and sent it off. Yeah, so you can probably start mixing now. Open up real bit. Open up real bit.
Over here, Dr. Reeves, if you want to show, and then mix. After yet, you have to seal the teeth with the sealant. So it's a part A, part B. You put a drop of each, equal parts A and B. And then you mix them together. Once you start the mix, they start to set. So I'm not going to mix it until he gives me the.
I'm
ready.
Yeah.
Okay. You mix them together, get a good mix, and then he's got to seal the teeth with this. There you go. You can bend this too if you need to.
Hard.
Open up. Yeah,
Get
you
him
got it.
off.
Open it real bit.
Yeah, that's just seal it.
So this is chemical cure?
Right. It's all chemical cure. Anything that's two-part is chemical cure.
Yeah, I wasn't sure if it was maybe a mix.
Open it real bit.
Yeah. So you have
Chemical.
I don't know what the working time with this is. You probably have about a minute or two. I'd have to read the instructions again, but.
Yeah, let me see the section there.
Okay, now I mix the paste. Part B. Same thing, it's chemical cure. Doesn't start reacting till you mix it together. You do have they say a 3-minute working time once this is mixed, but it seems to be more like 5 minutes from what I've seen since I've been using it. Again, equal parts A and B. And then can I mix and we're going to do the bottom first. So let's get this mixed. And again, from this point forward, I have 3 minutes according to the instructions, but my experience has been it seems to take about 5 minutes to set up.
So this is just for the lower part, and then
This goes into bands. This is your cement. And we're going to repeat the exact same thing up top. So load it up, and again, you don't need a lot in here. You just need to coat the inside of the band. You don't have to have tons of excess coming out of everywhere. So just get a nice even coat, and then let's go to the other one.
Like this with the camera, the movie gonna look narrow. So you do it like this.
Okay, so it's loaded, and I'm just going to hand this over to Dr. Lockhart.
Yeah. I try to do it like that all the time. Very narrow.
Go ahead.
Open up real bit.
Open up big there.
Okay.
Go ahead and seat it in.
No pressure, buddy.
He took his separators
Open up.
out, so we got to push a little bit. If the separators would have stayed in,
Open it. Open.
wouldn't be quite as hard to get it in. But our patient bear here did an separation removal.
Open up real big.
I have
No,
Don't talk.
Don't
Don't
talk
talk.
there.
There you go. And don't bite my finger either. Open up.
And again, this is a chemical cure, so you can hit it with the light all you want. It won't. Here, hold this, bear. It won't help you one bit.
Okay, open up. No pressure.
Turn that light on.
Open up.
Yeah, you can turn. Light won't affect it.
It won't
so-
matter.
Yeah,
Put
you
the
can
light
put
on
the
there.
light on it. Not like the other stuff. Not like the light cure.
Is it better?
And bite down for me, bear. Squeeze, squeeze, squeeze. Open.
Might be worse.
Bite.
A lot of contrast.
Yeah, you're better without
Open up.
it.
Yeah, bite one more time. Squeeze. Okay, open.
Good job,
All
bud.
right, bite. Okay. All right. And Dr. D, can you do me a favor and got me a little green brush? Just get out from under the bottom of the bed. Not yet. Open up. Open up real big. Bite now for me. Bite. Squeeze, squeeze, squeeze.
Actually,
Okay,
what
open.
you can do is
And bite one more time. I'm listening. Bite. 'Cause I like to bite into it so it
Yeah.
can really get into the cotton.
yeah.
Okay, open up.
No, you're already etched on top.
No, not yet. 'Cause I didn't want to.
Not
I
yet?
couldn't keep it. Okay, so the next step will be to repeat the exact same process for the maxillary component and do a brief alignment of the pistons before the final attachment of the maxillary component to the mandibular component, which fits right in here, and then I would twist it in. So like I said, we're not going to do it just yet. Just one last thing. Okay, pause it.
Dry this. Let's do one side at a time. You're gonna dry it off, and then the next thing I do is apply this thread locker. And all it is it locks the threads so that they don't unravel. They're not supposed to come apart, but I've had them come apart in the past. So since I started using the thread locker, they don't come apart. I put my finger here because this stuff comes out really, really fast, and you just put a drop on the threads. Don't want the, there it is, little blue stuff. Yep, that's what happens. It comes out real fast. That's good. And then we're going to take this and just clean my finger off there. Need you to open there and just slide your lower jaw forward. Slide forward. You're going to come way forward. He's going to come farther forward.
Slide your jaw forward. Keep coming.
You got to come forward.
Slide it forward.
You might be off to the side. I'm not sure. Okay. Biggest thing when you put this in is you don't want to strip the threads. You got to make sure the threads are going in straight. And just take it in and tighten it right up. Okay. Let me just make sure that's tight.
Do you leave one side not Do you tighten it all the way on one side, or do you kind of insert them both and then tighten them?
No, I tighten it all the way. Okay, now let's do the other side. Same old, same old. Dry the threads. Put on a little bit of our thread locker. See if I can get this on the thread. I can get it not to come out as fast. It comes out fast. And then come on forward there, Bear. Oh, dry the threads too. I'm sorry. Let's dry that.
Trying to get my thumb out of the way there.
And then just insert the Allen wrench. You can see why you don't want to be doing this in the back of the mouth. Slide forward there. In the back of the mouth, because it's hard enough in the front. Get the Allen wrench in there. Hold on. There we go. Pull his lip down away from there. Thank you. And just screw it right in. Just make sure you're not stripping the threads. Tighten it. There we go. These all together. Let's go back and make sure this one's. Okay, he's good. And there he is, right in place. And that's the bite.
And so his jaw is positioned forward, just like what you want.
How's it feel, Bear?
Oh, now he has nothing to say.
Yeah, where are all the words? He's trying
Now
to
he
talk.
has nothing to say.
No.
Feels weird.
I can't chew. I have to like literally do this motion.
You'll get used to it.
Get used to it. In a week it'll be like the shoes on your feet.
I'm Jaws from James Bond.
Yeah.
He's the last person you want to do an interview on.
Oh, come on!
How old were you? You were like -2 when that movie came out.
Hey, take some
Bite
photos
down.
too,
Yeah.
Dr.
I get
Lockhart,
it.
with your camera.
Okay. All right, bite that all the way down.
Okay.
There you go. So beforehand, he had a lot of overjet, and so we took our bite. We took our bite registration with his jaw position forward, and that's how they constructed the Herbst Appliance. So now with it fully intact, that's where his bite is, and so we'll see what happens. And how old are you, Bear?
It's our turn.
13.
Just turned our turn.
So you know anything about the growth spurt around this time is when you would want to do it.
All right, let's just get a look
So
at
that's
this.
the top piston. And
Bite
then
down.
Bite. Bite.
Bite down.
And so that's his jaw can only go in that position there.
Yeah.
And you can see his canines are in a class 1 position. And like I said, again, without the Herbst Appliance, he is class 2.
Okay,
molar
open.
and canine.
Open. Open. See that thing hinging on the top?
Yeah.
And bite down. Bite.
Ah.
Yeah.